Hello, hello, everyone. Kimsey here, and I am so glad to be here for this Monday's live talk. So, yeah, just to just super glad to be here. All right, everyone. So, for those of you that don't know me, my name is Kimsey Berkwin. I am an integrative nutritionist in my online nutrition and wellness practice called Progressive Health and Wellness, where I help busy, ambitious men and women who are struggling with their mental health or performance. And we take, by taking a root caused body mind approach, to help them find answers and implement a plan to restore feelings of grounded confidence. So, if today I'm going to talk about, and every Monday, just like I do, I go live talking about some of the most common root causes and the science behind functional mental health, essentially. So, today I'm going to talk about the connection to thyroid. Could hypothyroidism be affecting your anxiety, depression, ADD, ADHD, or just poor focus? And I want to keep this talk short and sweet. So I'm going to get straight to the point and keep it really focused. So, the thyroid is a butterfly shaped gland that sits at the base of your throat, and it produces two main hormones, T4 and T3. And the thyroid hormones can influence every single cell in the body has a receptor for thyroid hormone. So the thyroid hormones can influence our metabolic rate. They influence our ability to burn or to build muscle. Sorry, I just remembered some people wanted to be notified when I went live. So I am doing that right now. Here we go. Okay, they influence your basal body temperature, and every neuron in the brain has a receptor for thyroid hormone, which means that we need thyroid hormone in order to manufacture the key players like serotonin and dopamine and norepinephrine and acetylcholine, all of which influence, and GABA, all of which influence our mood and motivation and drive and focus and stress resiliency, I'll say too, and sleep. I'm just going to keep them going. So, the most common lab test, what I want to share today is now that you have kind of a brief understanding of the thyroid. Actually, I'm going to give a little bit more about the thyroid, information about the thyroid too. So, we'll talk about some basic physiology and 4 different ways that the thyroid can break down. Then we'll talk about 3 lab tests that you definitely want that were most commonly not included in a thyroid workup if you've had that done. And then I'll talk about a few easy lifestyle nutrition recommendations that you can start implementing like right away to support your thyroid health. Okay, so most people, and especially if you start talking to your doctor about like fatigue or you can't lose weight or trouble sleeping or fogginess or constipation or diarrhea or cold, like feelings of cold, cold all around, but then especially cold hands and feet, thinning hair, thinning outer third of the eyebrow. These are some other, and then of course, the anxiety, depression, or difficulty with focus and concentration. These are some other key symptoms of hypothyroidism. So if you've gone to your doctor talking about these and they say, let's test your thyroid, more than likely you had TSH run. So I want to talk about what happens when TSH comes back normal, which so often is the case for so many people. Yet that doesn't mean that all is well necessarily with your thyroid. So I want to share 4 different ways that the thyroid or thyroid health can break down. The first is primary hypothyroidism. So in primary hypothyroidism, the thyroid itself is not producing enough of its primarily T4 because T4, 93% of what the thyroid produces is T4. But T4 is an inactive form of the hormone, which means that T4 has to be converted into the active form of the hormone, T3, which is the hormone that actually does work in our body. That's the hormone that influences all the things that I just mentioned. But different organs and different tissue will need different levels of T3 of thyroid hormone. So they're responsible for converting T4 into T3. We'll see a large propensity of this conversion happen in organs like the digestive tract, the liver, the spleen. But then at the cellular level, cells are also able to convert T4 into T3 at the rate that they need. So primary hypothyroidism refers to when the thyroid itself is just not, it's underperforming, right? It's just not producing enough primarily T4. In this pattern, we'll see TSH, thyroid stimulating hormone. So the brain governs thyroid activity, and the brain will release thyroid stimulating hormone in order to get the thyroid to produce its hormones, as the name implies. So if the thyroid's underproducing, the brain will essentially start like screaming at the thyroid. So you'll see high TSH and low T4, low T3 in as patterns of primary hypothyroidism. So that's kind of the classic. So what happens if you don't fit into the classic, right? So let's talk about the other ways that the other areas that the thyroid can break down. So number 2 is cellular resistance. This is often referred to as or interpreted as a stress response. So what happens here is the brain is communicating with the thyroid just fine. Sometimes there's a little bit of an underconversion. So it can be one or the other. I'm sorry, undercommunication. It can be one or the other. But in the presence of chronic stress, emotional stress, or inflammation, or blood sugar, metabolic swings, there can be a downregulation of the thyroid. So we'll see lower levels of TSH. And then the thyroid is still producing its two main hormones okay. So T4, T3 can be within normal or optimal ranges, but there's a key metric, a key lab that we'll see be off. And this is one of the 3 that you want to write down and ask your doctor about. And it's called reverse T3. It's abbreviated as RT3, oftentimes on labs. So reverse T3, what that's representing is basically at the cellular level, the cells are unable, you can think of it this way, the cells are unable to handle the energetic intensity that is thyroid hormone. And so rather than converting T4 into T3, the cells convert it into a competitive binder, which is called reverse T3. It's like a backdoor way of protecting themselves from too much T4. So by definition, we therefore are not getting enough T3 at the cellular level though. And so it creates symptoms of hypothyroidism. So as I mentioned before, what's really driving that is chronic stress, chronic inflammation, oxidative stress, gut microbiome imbalances, other hormonal imbalances like cortisol or insulin levels, toxic exposure. We'll see this oftentimes with mold exposure, for example, or environmental chemicals. Those would be at the root of, or some of the factors that can affect reverse T3. We'll also see this with high medication, somebody that's over-medicated. They're still having hypothyroid symptoms despite taking thyroid medication, and their TSH, their T4 might look okay, but the reverse T3 is really high. And it shows that their body is like becoming resistant to it. Their body is essentially saying, this is enough. Oh, we got a question I just noticed on Facebook here. What causes your thyroid to be at 10? I'm guessing you mean TSH. And if you're saying TSH, if you're meaning TSH, that would be definitely suggestive of hypothyroidism. Honestly, I would listen to everything that I'm describing today because this could really provide some answers for you. It could be primary hypothyroidism. It could also be where I'm going next, which is Hashimoto's thyroiditis. So Hashimoto's thyroiditis is autoimmune against the thyroid. It's an autoimmune attack against the thyroid. So we'll see antibodies. Actually, you know what? I'm going to get to this in a minute. But what happens in Hashimoto's thyroiditis is the immune system attacks healthy tissue that is the thyroid. So when this happens over time, the degradation of thyroid tissue causes hypothyroidism. But some key, really important things to know. One, you can have the presence of antibodies indicating Hashimoto's before the symptoms or before the lab values become pronounced, like out of range, or the symptoms are noticeable enough for you to go to a doctor. Meaning, like maybe you just feel tired sometimes, maybe you just feel kind of puffy, maybe your bowels are changing, but it's nothing enough to seek medical attention per se. Albeit when it becomes more progressed, it absolutely will be. So, that's important to know that you can have antibodies already developing before the overt symptoms and before TSH and T4 start to change. Second thing that's really important to know is in the initial phases of the autoimmune response, there will be varying levels of, and based on the degradation at any given time, the damage to the thyroid tissue, there will be varying levels of T4 and T3 released into the blood, which means some people with Hashimoto's will experience alternating symptoms of hypo and hyperthyroidism. Even sometimes lab tests can alternate between hypo and hyper, or even pass through what looks like normal lab values. So that is also really important to know. Now, medical insurance is, doctors cannot, it's really unfortunate, doctors cannot run the thyroid antibodies, which are thyroglobulin antibody and thyroid peroxidase antibody, TG or TPO, unless TSH is elevated. So because of this, despite the fact that research shows that 90% of what appear to be primary hypothyroid cases are actually Hashimoto's, despite this, people will fly under the radar with Hashimoto's for years sometimes. And the problem with this is Hashimoto's is a completely different ballgame. Hashimoto's is a problem with the immune system, not the thyroid itself, right? The thyroid is just an innocent bystander. The immune system is attacking the thyroid, and the immune system needs to be addressed. That's where we'll look at things like gut health and diet and toxins and stress and things along those lines. So that's a game changer. So that's the third pattern. The fourth pattern, and so for the person that asked what causes your TSH to be at 10, Hashimoto's absolutely could do that. Here, I think, let me see if I can actually see who's asking these questions. Oh, Claudia, hello. All right, I had my thyroid removed with nuclear medicine, and 2 years ago I had gastric bypass and lost 128 pounds. It's great about being able to lose the weight. If your thyroid removed, then that could influence the TSH numbers. I would really look into medication and if the medication is being appropriately dosed, and that it could be really helpful to test the reverse T3 in that case too. Okay, great. So continuing, the last pattern, the fourth pattern is, this also is a result of, it's called euthyroid. This also is a result of chronic inflammation, chronic stress, blood sugar swings, other underlying factors. But it's poor conversion. So again, the brain is communicating with the thyroid just fine. The thyroid is producing T4 as it should, and some T3 as it should, but the body isn't converting T4 into T3 at the rate that it should. So T4 might look normal, TSH might look normal, but T3 is suboptimal, total or really reverse T3. Here we'll see poor conversion. Sometimes there's higher thyroid binding globulins. This can be a problem also with like estrogen dominance. We'll see this happen with higher estrogen levels, or women that are taking estrogen replacement therapy or are on hormonal birth control that contains estrogen. That can influence this. And then chronic stress is a really big one that can also influence it, as are nutrient deficiencies. So selenium, iron, zinc, vitamin D, there are certain key nutrients that are important for mediating that conversion. Okay, so now that we understand the pathways, the 3 labs that you definitely want to ask your doctor for if you haven't had these run already, I mentioned the reverse T3. The next 2 are those 2 antibodies, thyroglobulin and thyroid peroxidase. I just finished an appointment with a woman who has had hypothyroid symptoms, amongst other things, and her TSH looked normal, her T4, her T3 did, but she had thyroid antibodies, and she has a lot of the symptoms to fit it. She wakes up and often feels puffy. She thinning hair. She's had some joint pain. She has other signs of other autoimmune conditions. Her digestion tends to be slower. So she has a lot of the signs of it. So that is my definite recommendation to you is if you're having some of these symptoms, and especially if you're struggling with your mental health, look at or consider your thyroid. So now what do you do? Well, to some degree, it depends on what the problem is, right? Where the pathway is breaking down. But some things that can help across the board. One is minerals, particularly selenium. So selenium is really important for thyroid hormone production, for the conversion of T4 into T3, and it's really helpful in the immune system with Hashimoto's. So I'll often have my clients eat just 4 to 6 Brazil nuts a day because that gets you a therapeutic dose of selenium. You can supplement with it. It's often in, part of multivitamins or part of other supplements, thyroid supplements. So you can supplement with it, but I would start with eating 6 Brazil nuts a day because you're going to get a lot of other benefits from the Brazil nuts too. All right, number 2 is balancing out your metabolism. So with hypothyroidism, too low carb of a diet could be problematic. It puts more stress on the thyroid. So we don't want high carb, obviously, but we don't want too low carb, like ketogenic, for example. So I would eat more of a moderate carbohydrate diet, but in particular, timing is important. So I encourage my clients to get in about 12 to 14 hours of fasting overnight. So between when you finish eating and when you start eating the next day, start working gradually and slowly up to that 14-hour mark. You don't want to do too long of fasting though with hypothyroidism too, because that can be, again, problematic. So the 14-hour mark. Then break your fast with primarily protein and healthy fat with some complex carbs. So for example, a couple of scrambled eggs with like half a sweet potato and some spinach. Or you could do a protein shake, like a vegan protein powder blended with blueberries and coconut cream, for example. That way you're getting a lot of protein. Thyroid hormone is made from protein, and it's balancing out those blood sugar swings that can really worsen hypothyroidism. And then from there, start with eating every like 3 hours, but gradually start to space that out to every 4 hours, and then finish eating at least 2 hours before dinner. And then lastly is stress. Stress is huge. It has a really big impact on the thyroid. So I recommend doing breath work during the day and throughout the day, especially in the morning or before bed. I just blanked on the name. Resonance breathing is a great pattern. So that's where you breathe in, you prolong the exhale basically. So you breathe in to a count of 4 and exhale to a count of 5 to 6. That we talk about heart rate variability biofeedback training all the time. That's really helpful, but focused intentional breath work, even for just 3 to 5 minutes, breathing through the nose is really helpful. It's a physiological sigh. So it sends messages of relaxation to your body. So that is really helpful. And then you can also, as far as minerals go, other mineral dense and vitamin dense foods would be foods like liver and shellfish and bee pollen and cacao and shiitake mushrooms. Seaweed is also great. So iodine tends to be villainized, especially in Hashimoto's. It doesn't need to be completely avoided. And especially if you don't have Hashimoto's, iodine is going to be great for these other conditions. So iodine doesn't need to be completely avoided, but excess supplemental could be problematic. So whole food sources, right? I love recommending bone broth and cook it with seaweed. That's a great option. There are seaweed flake powders out there or products out there that can replace salt. That's a great option for getting in more seaweed. Mineral dense salt like Himalayan pink salt is great. Putting a pinch of that in your water throughout the day, that's really helpful, using that on your food. Um, those are some kind of baseline recommendations. And then cod liver oil is really helpful too for the vitamin A, some vitamin D. That's really helpful for the thyroid also. All right, everyone. From there, it starts to get a lot more bio-individual. Like with Hashimoto's, for example, the evidence is pretty clear that gluten affects Hashimoto's almost as much as it does celiac. So being gluten-free on Hashimoto's can be really, really powerful, limiting your sugar, avoiding processed foods and things along those lines. But from there, we get a lot more bio-individual with it. All right, everyone. I hope that helps. Drop a comment if you're watching the replay or if you're watching this live, but especially if you're watching the replay and more questions come up, tag me in it, ask the question, let me know. I will always respond. And then also stay tuned for tomorrow. I've got some big news, some exciting news dropping. So in my Facebook group in particular, Holistic Solutions for Mental Health and Wellness is where I will be dropping that information and trickling it out over the next few days. But this could be really, really impactful for you if you're doing all of the things in your life, if you're juggling the job and your kids and your marriage and your relationships, and you're trying to find time for yourself somewhere in between, and you feel like your mental or physical health is just starting to crumble under that pressure, and you're noticing more anxiety or depression or poor focus or maybe insomnia or fatigue or digestive issues, then this will be a great opportunity for you. So make sure to join that group and follow along with that. Okay, everyone. Hope this was helpful. Have a wonderful rest of your day, and I'll see you next week. Bye.